Hi, this is Dr. Kathleen Hallinan, and we're doing another weight loss vlog today. So, I was asked to talk about human growth hormone injections. This is a pretty dicey area. It is an interesting question, and I know that people use this, some providers or practitioners or physicians do obtain human growth hormone and give it as an injection for weight loss. It is not FDA approved for this indication. And while there have been some studies, the one that sparked all of the interest was a study in the New England Journal of Medicine in 1990. It did show that there was an increase in lean muscle mass and a decrease in body fat in the cohort or group of patients that was injected with human growth hormone. A lot of studies really since then have not been able to reproduce those findings. So, and when you do, there are some studies that have shown in people who are placed on low calorie diets some more rapid, what's called anabolic or breakdown of fat for energy effects in patients or people in study groups that were given human growth hormone compared to placebo. However, the FDA has not approved it for this indication for several reasons. The data behind these uses of it for weight loss, it's okay to use human growth hormone if like you have HIV and AIDS and have wasting from your disease and you need it to for treatment of other disease states, or if you have a pituitary axis problem or something like that. But in an otherwise healthy person, if you want to consider strictly using human growth hormone for weight loss, you're kind of, I would just advise really to take a lot of caution and think about this a lot, because there are a lot of potential side effects from human growth hormone. And I listed, here's my board again, I listed a few. So, and the big one, right, is down at the bottom. There's some concern that there's a little bit of increase in leukemia risk in patients who are given human growth hormone over a period of time. So, but a lot of the others are very concerning as well. People get like nerve pain symptoms, blurry vision, changes in their heart rate up or down, depressed mood. You can have changes in your bowels. And the cancer risk, of course, is the biggest issue. So I would, these are kind of concerning things. And that New England Journal study was one of the few studies that really showed a weight loss benefit, and there've been very few studies to really reproduce that. So that's why the FDA, as of yet, has not approved this and did actually issue warnings in 2012, which you can pull up online if you have any curiosity about this. Warning that a lot of compounding pharmacies and places in the United States are using human growth hormone in supplements and compounding them also for injection use. But I would be very careful about use of human growth hormone. And there are so many other options out there that have been really tested fully and vetted, if you will, for their efficacy and for their safety, all things considered. I do agree there are risks with everything. Phentermine has risks of bumping your heart rate up and causing a rapid heart rate and high blood pressure. That's why you have to be monitored closely, and that's why you shouldn't just buy it online. You should do it under the guidance of a physician, and even then, sometimes you'll have people who have a heart rate spike. Medications such as Topamax work very well, but certainly have side effects, including kidney stones and electrolyte imbalance. Medications like Wellbutrin are very effective, especially if you're already on an antidepressant, but can do things like lower your seizure threshold. So, however, all of these other options, even with their risks aside, have been much better studied for efficacy and overall have a much better safety profile. So I would stick with the things that are already FDA approved, whether it's Phentermine, Ally, Contrave, Qsymia, even some of the diabetes medicines that allow you to lose weight, metformin, Victoza. These are all medications that are quite safe, especially when used under guidance, and you can manage the side effects if they occur. So I hope this has been helpful for those of you interested in human growth hormone. If somebody tries to shoot you with human growth hormone, I would take a step back and think about it and do a little research and make sure you've exhausted all of your other options first. Okay, hope this is helpful. You guys are doing great. And again, if you're kind of just coming into this, there are now, I think, 17 or so videos in the bag. So please feel free to go through and look at the rest of them and pass these on to anybody you know who might need help. Thank you.